संवसारीक काळजाच्या दिसा निमतान मणिपाल हॉस्पिटल हांच्यांनी पत्रकार परिशदेंत घेवन हृदयविकाराचो वाडत आशिल्लो हुस्को आनी बेगीन सोदून काडपाचे प्रगत उपचाराचे म्हत्व उक्तायलें. ह्या कार्यक्रमाची येजमानकी श्री मणिपाल हॉस्पिटल मुखेली हरिप्रसाद MV आनी हॉस्पिटलाचे तज्ञ हृदयविज्ञान पंगड हाजीर आशिल्ले.
Our hearts in various ways. This is one of the ways hospitals ensure that we talk about heart and healthy heart. We always quote this thing saying, healthy heart is the key to unlocking a better future and things like that. But we often ignore or we often tend to not look at what's most important to make sure that you have a healthy heart. With that, let me first welcome all of my colleague doctors who are here from the cardiology department and all the supporting departments who work very closely to make sure that Manipal Hospitals Goa has a cardiology department that can cater to all kinds of needs.
तातूंत ज्योती कुंसूर, डॉक्टर सभ्यासाची मुख्योपाध्याय, नॉयल हेड्रिक्स, डॉक्टर राकेश देशमाने, डॉक्टर पंकज म्हात्रे, सल्लागार अणु केंद्रीय वैजकी सत्रांत दोतोरांनी जिणे पद्दतींत बदल, उशिरांचे निदान आनी ताचे कडेन संबंदीत आशिल्ल्या भलायकी परिस्थिती कडेन संबंदीत आशिल्ल्या काळजाच्या दुयेंसाच्या वाडट्या प्रमाणाचेर भासाभास केली. ताणें दुयेंतींचे परिणाम सुदारपाक TAVR, ट्रॅस्कॅथेटर, ऑर्थोटिक वाल्व रिप्लेसमेंट ह्या आधुनीक उपचार पद्दतीच्या भुमिकेचेर भर दिलो. त्याच बरोबर सुरवातीच्या काळांत निदान, वेळार उपचार आनी जागृताय निर्माण करपाची गरज आसा अशें सांगलें.
This year the theme for World Heart Day is don't miss a beat. So what does it mean? If you consider cardiovascular diseases, it is one of the largest non-communicable diseases, the cause of mortality. So when I checked the data, last year there were 1.72 crores deaths because of cardiovascular element, which include mostly cardiac, vascular also, stroke and all those things. So the theme is to increase prioritize the individuals for their heart health. Don't miss a beat, don't miss the signs of your heart. Don't take for granted the signals which heart gives to you for your health. Do your regular health checkups, timely medical action, and prevent and manage your cardiovascular health. So to start, this was the introduction for World Heart Day. So today's focus will be what we as a Manipal Hospital serving here, the catering the cardiac intervention, surgical as well as cardiological. So what we are doing, so there is Department of Cardiology, Department of Cardiac Surgery, Department of Cardiac Imaging, and we do the bypasses to all the arteries, blocked arteries. And advantage being, as I told you, the patients will have less blood loss. Actually, we use quite less amount of blood. In some cases, most of the cases, we don't use the blood at all, blood products to the patient. Then ICU stays less. Most of the patients are extubated on the same day, in the evening after doing surgery in the morning, and next day they are shifted out of the ICU. So chances of infections like external wound infections and all those things are less. So patient overall have less hospital stay. So these are the advantage. And another good thing is we have done the surgery in the geriatric age group also. Patients now there is because of the increased lifespan, we have wide range of cardiac cases. And because of the cardiac illnesses increasing in the young population, which is alarming, we are getting patients as young as in the 30s. We did a case, the bypass on a patient was 37-year-old, youngest what we did, and the oldest what we did is 85-year-old. Total number of cases we operated who were more than 80 years, there were 46 patients, and oldest was out of this 85-year.
Cases which are, were thought of as being inoperable have been operated very successfully by Rakesh sir and his team, and they have come out. So at every stage there is treatment available. So that is the message which we need to send out to the public. 14,000 procedures in the cath lab. We started somewhere in the middle of 2014. That is when our cath lab got set up. Almost like little after Goa Medical College, we started. So as of today, we have reached almost 14,000 cath lab procedures, out of which almost 4,500 are coronary angioplasties. Besides that, we also do pacemaker implantations. Nowadays, we are also doing a lot of structural heart disease. Structural means when the heart valves and all are damaged, and patients are, cannot be taken for surgery, or they're very high risk for surgery. We have successfully done those cases in the cath lab. Structural heart disease. Also, closure of holes in the heart like ASDs, atrial septal defects and all those kind of cases are done. Besides cardiac interventions, for the heart, we also open up other arteries, like for the legs, the arteries going up to the brain in people who have strokes, to prevent strokes. And we are also blessed here, by the Goa government, as we are part of the Deen Dayal DDSSY scheme. So we are able to perform a lot of procedures in people who cannot afford it. It's not that it's a private hospital and the charges are high. Our hospital also helps us a lot in making sure that a majority of cases are taken under the Deen Dayal scheme, so the patient doesn't have to pay, the Goan public doesn't have to pay for many of these life-saving procedures which are done in this hospital.